Hello, welcome everybody. Thank you so much for coming today, making it to this first session of our seminar series this term, our seminar series on comparative social policy, called A New Dawn for Social Policy. So before I introduce our speaker, Professor Julia Lynch from University of Pennsylvania, I'd like to say a few words about the seminar series. So today's session will focus on COVID. Fairly unsurprisingly, given that we are in the middle of a lockdown and that, many people have been suffering because of this pandemic, and this is really the topic of the day. And it's really great to have somebody that one could actually call an expert, right, on health outcomes and who will really be able to tell us interesting things on dynamics, social and political dynamics in this pandemic. Now, the seminar series, we've decided not to actually focus it only on COVID, because there's also a lot of COVID fatigue among many people. So we'll cover many other challenges, important challenges, societal challenges that arise these days. We were actually initially thinking about calling our seminar series to have the word apocalypse in it, because there's really this conflation, right, of problems. We also have Brexit in the UK. We have climate change, we have the rise of illiberalism around the world, we had the migration crisis a few years ago, we all also know about the challenges posed by technological change, automation, robotization, digitization for welfare states. And these are actually topics that we want to cover really this term, not only to understand the consequences, the social consequences of these different societal challenges, but also to think about potential social policy solutions to them. And I hope that, Julie, you will also have something to say on that, not only to give us a kind of, present the dark picture that we, that many know about, but also perhaps to think about solutions. Now, let me introduce our speaker, Julie Lynch. I'm very, very pleased, and I'm sure all the participants, all the guests today are really pleased to be able to welcome you. Not really in our department, but at least as a speaker in our seminar series. I've known Julie for quite some time now. I won't tell you how I met her, but I've always considered her actually as one of my mentors, and it's also a personal pleasure for me to have you here today. Now, most of us in in social policy know Julie for her work. She's worked on many things, but definitely her first book has been noticed on the age orientation of the welfare state, for which I think she had also won an important prize. Because it came out from your dissertation, the Gabriel Almond Prize at APSA. And today, Julie, not today, it's already been a year now, but Julie published, it's really interesting, the story, I think, with your book. She published a new book called Regimes of Inequality, the Political Economy of Health and Wealth, about a year ago, just before COVID really started. And I think for the social policy community, right, for our academic community, this is a very timely publication. And I think your presentation today, Julie, will build largely on that. But I think from your point of view, it's not been very lucky timing, because I think you were also supposed to make a tour and many of your talks were cancelled. So I hope we can partly make up for that now, a little bit late, too late, but this is also an opportunity for you to advertise your book. Now, Julie has been, ever since the publication of her book, she's been working even more. I think she's going to tell you also about another edited forthcoming volume. I saw that you're also editing a special issue of the Journal of Health, Politics, Policy and Law on COVID. You already have an article in it. So you're actually very much active from a research point of view on COVID. I think you even you were invited as an expert to either the US Congress or the Senate. So, I mean, you are really the expert, and without much further ado, I'll give you the floor now, Julie. And I mean, we can't really welcome you via an applause, but I assume that everybody is doing that from home now. Welcome, Julie, and thank you for being our speaker.
Thank you so much. It's really a pleasure to be here. I wish I could be there in person, but you know, such is the world. So I'm going to share my screen with you now and give you a look at my slides. I'm sorry that that means that you won't be able to see me during the talk. So you'll just have to imagine me. Let's see. Oops. There we go. Okay, can everybody see the title slide here now? All right, so once again, thank you. I'm delighted to be here, despite the fact that I think the New Dawn phrasing of this series, for some reason, is slightly alarming to me. But it's a good time to think about crises. So wars, financial crises, global pandemics, things like this are often seen as shocks, breaks with the past. But empirically, there is very often a great deal of continuity with what came before. And the case I want to try to make for you today is that I'm a bit skeptical, actually, about the potential for the pandemic to be a moment of true disjuncture when it comes to the politics of inequality. Furthermore, I think that understanding the forces that are pushing for continuity and for path dependence needs to not only be involved thinking about policy legacies as we typically understand them, but also we need to keep our eye on the interdependence or bundling of different forms of inequality, and how this bundling is linked to politics is also critically important. So that's sort of the tenor of the remarks that I want to give today, which, as Marek said, are drawing on two recent books. So Regimes of Inequality, which came out earlier, well, in January of last year, and the new book, The Unequal Pandemic, COVID-19 and Health Inequalities, which I've co-authored with Claire Bambara and Catherine Smith, which should be coming out in June. So let's start with Regimes of Inequality. So the whole point of the book is to explain the new normal of high and rising inequality. It's become such a sort of fact of our lives that we often, I think, take it for granted. So about 150 years ago, democracies discovered how to reduce inequality by redistributing income, by engaging in targeted public spending, by regulating markets, essentially by building welfare states. And then about 30 to 40 years ago, politicians seemed to develop amnesia. They forgot how to do this kind of thing. And at around the same time, but in some cases with a little bit of a lag, the issue of health and health inequality started to become wrapped up in public conversations about inequality more broadly. First, researchers and public health experts, and eventually politicians, started looking at health inequality as an issue that could potentially work politically as a way to help us get back to a more egalitarian society. But if we fast forward to 2021, it's become abundantly clear that that didn't work. The COVID-19 pandemic has been experienced in a highly unequal way, with many more deaths and illnesses occurring among groups that are already on the short end of the equity stick. And this should lead us to wonder why shifting the focus to health equity in the 1990s and 2000s, which many governments did, why didn't that help to reduce inequality more broadly? Or put another way, why have both economic and health inequalities been so resilient over the last 30 years? Sorry, going the wrong way. All right, so most of you have probably seen this figure or one like it. And this is simply showing rising inequality in Europe. So here we see that across Europe, the share of the national income that is owned by earners in the top 1%, the red line, rose from about 7.5% in 1980 to about 11% in 2017. While the share that is earned by the bottom half of the income distribution, the blue line, shrunk from about 20% in 1980 to 18% in 2017. And we've seen parallel increases in inequality of educational attainment and in health status by social class also emerging during this period. I particularly like this graphic, and I owe thanks to Claire Bamborough for providing it to me, which simply shows the difference in life expectancy, healthy life expectancy, depending on which Newcastle metro stop you live nearest to. So if you live in Byker and you are 65, you have a 63.8 years of healthy life expectancy that you can expect. Whereas if you live in South Gosford, one of the more wealthy parts of Newcastle, you can expect to live 71.5 years in healthy life.
Julie, apologies for interrupting you, but I would not. Okay, so we
sorry, failed to advance. So here's the lovely image shared by Claire. So what is the upshot of all of this? What should we be thinking about as we think about this high and rising inequality? Well, I think the first thing we should realize is that persistent inequality is unexpected, and the explanations that we have for it as social scientists fall short. So our core expectation coming out of the sort of political economy of inequality literature, it comes from the Meltzer-Richard model or from similar thermostatic models, both of which predict correction towards lower levels of inequality when inequality becomes greater than what the bulk of the population or the median voter would prefer. But in fact, we know that mass publics tend to support greater equality, and greater government action to reduce equality, and yet there has been no correction. So why is this? Why is this correction not occurring? There are a couple of standard explanations. Some of them are economic, some are political, and I think both the economic and political explanations can help to understand, but they don't sort of fully help us to understand what's going on. So on the economic side, we can think about skill bias, technological change, or the sort of models of economic growth and wealth concentration that Piketty has popularized. And yet I think Piketty would be the first to admit that returns to skills versus returns to capital versus returns to unskilled labor, these are all subject to politics. These are not sort of immutable facts of nature. Political explanations do a little bit more work in helping us understand why inequality might be more resilient. And certainly the Marxist theories sort of that draw on the political power of economic elites can go some way towards explaining this. Wealthy elites who benefit from the status quo distribution tend to be powerful, but they're not all powerful. Capital holders always rule in coalition with other people in the post-war period. And even many elites have become very worried about extreme inequality. The IMF, for example, has come out saying that inequality has gotten too high. So there's something missing from our explanations of why inequality has been so resilient. And the case that I make in my book is that we really are missing an explanation for why, even when governments try to reduce inequality, why is it that they tend to fail? So the central argument of regimes of inequality is that while these political and economic explanations, these existing explanations, probably help us understand in part the resilience of inequality, there is something else going on. And that is that how politicians talk about inequality as a public problem has an effect on their ability to solve the problem. So this is really a pretty constructivist argument, which for those of you who are familiar with some of my earlier work may come as something about it as a surprise, but I was really just sort of led where the research led me. I did not come into this project with a theory as such about what was going on. So what I have found is that the reframing of inequality, sort of a change in the way that politicians talk about inequality, once neoliberalism starts to have an effect in the politics of advanced industrialized democracies, that this reframing of inequality is influenced by earlier institutions that were built in order to constrain inequality in the post-war period, so earlier welfare state institutions. And that this reframing of inequality ultimately makes it harder to address. And that's what I'm going to try to explain to you today. So the puzzle that I confronted in regimes of inequality is that health inequality gets on the agenda as a public problem across the countries of Europe and elsewhere in the OECD, starting in the 1990s, and really by sort of 2014, everybody had started talking about it. And the way that governments talked about this problem of health inequality was quite consistent with the way that the WHO and eventually the European Union had framed the problem of health inequality, which is that inequalities in health are a result of inequalities in the social determinants of health. So it's not just about your biology or even necessarily about your access to medical care, but it's about all of the things in your living environment and your social environment that affect your ability to sort of live a healthy life. So the details of how this problem framing got picked up in individual countries vary, both in terms of the content and also the timing of it. But what I observed was what to me was a very puzzling similarity, which is that all of the countries that picked up this sort of international consensus framing of how to think about health inequalities failed to do the things that the frame said that you ought to do in order to reduce health inequalities. Despite coming from different welfare regimes, different health systems, different kinds of political economies, and despite really good faith efforts on the part of many governments to address this problem of health inequalities. So I'm going to come back to sort of the details of what this failure looked like, but just to kind of let you in on the research design, the aim was to use the variation in the timing and the content of the way that health inequalities was framed to understand what drove this common failure to address the underlying health inequalities that drove health inequity. And I did this through process tracing methods, looking at health inequality policymaking in the UK, France, and Finland, as well as at the European level. So the key finding, which I'm going to try to lay out for you in the next 15 minutes or so, is a finding of equifinality. That is, governments ended up in the same place, but they got there by slightly different routes. So they all failed to address health inequalities and the underlying social inequalities that cause health inequalities when they took up the problem in the 1990s and 2000s. But in all of these countries, despite the different ways that this happened, it turns out that that failure was linked to the key institutions of the post-war welfare states that were built in the 1950s through the 1970s. So deep historical roots. And I'm going to argue that there is an analogous, although not identical, three-step process that all of these countries go through to kind of get to this result. At the end of the day, the result that we see, sorry, I'm not sure why my slides are advancing when they should not be advancing. Something must be touching my keyboard. So above all, the failure of the governments to address health inequalities is due at the end of the day to differences in how post-war welfare regimes interact with these rising neoliberal paradigms starting in the 1980s. And this just determines sort of the different paths that they take to get to this outcome. Okay, so you've all gotten a sneak preview of my 3-step process. So unfortunately, you can't see me pointing to a screen, but if you could, I'd be pointing to the left-hand side here because I just want to walk you through this at a broad level before we take it on bit by bit. So the interaction of post-war welfare regimes and regime-specific threats that are posed by a rising neoliberal agenda in the 1980s and 1990s leads to characteristic political sticking points and taboos. These in turn lead politicians' attempts to reframe the issue of inequality to make it less threatening. One largely unanticipated consequence of this reframing of the issue of inequality is a shift in the Overton window around inequality, which ends up making only those policy remedies that are the least effective seem like reasonable responses to the problem of inequality. So let me walk you through this. Now, normally when I give a talk about regimes of inequality, I focus on the second part of the process. So this is the part of the story that public health audiences are mostly interested in and sort of, the most kind of contemporaneous. But today I'm actually going to go through this part of it really quickly with no case material and no data, just sort of the basic ideas, so that I can then turn to the earlier part of the process where we can get a closer look at how the welfare regimes of the golden age affect the politics of inequality today, so that we can sort of start to think about some of these path-dependent effects that I'm interested in. Okay, so let's start with the reframing of inequality. What do I mean by reframing, and how does this happen? So first, let me situate you in time. And I'm going to talk more later about exactly what I mean by neoliberalism, but I want you to bear with me just for a moment and situate yourself in, let's say, 1990. The great neoliberal convergence that Stephanie Mudge and Jonathan Hopkin, among others, have talked about, by which center-left parties move rightward on social and economic issues, but particularly economic issues, leads to a convergence among the major parties on essentially a neoliberal economic agenda. And there are a variety of reasons why this happens. Some of it has to do with changes in the electorate. Some of it has to do with changes in sort of the sociology of party leadership. There's a lot of different stuff going on, but center-left parties, once they've made this shift to a more neoliberal set of economic policies, they're still center-left parties, and they still need a way to be for more inequality without running afoul of the whatever perceived political and economic constraints they might be facing. They're still left parties. So instead of ditching inequality altogether and just saying we're not interested anymore, which they could have done, they didn't. They reframed the problem of inequality. So what is reframing? A policy frame, as I think about it, consists of 5 elements: a definition of the problem, an attribution of causal responsibility, whose fault is it, a moral evaluation that often springs out of that causal attribution. Is this a problem? Yes, it's a problem because it's society's fault. It's not the fault of individuals, for example. An attribution of treatment responsibility. So whose responsibility is it to solve this problem? And then finally, a policy recommendation. What should people do to try to solve the problem? What happens under neoliberalism is that center-left politicians redefine the problem of inequality from being a problem of the maldistribution of economic gains. This is sort of the classical, framing of what the issue of inequality is, to a different kind of problem. It begins to be discussed as a problem of insufficient human capital. And this redefinition of what the problem of inequality is implies changes to all of the other elements of the frame. And we can see how this happens, for example, with health inequality, which is one example of a reframing of inequality in terms of insufficient human capital. So, as I mentioned, the reframing of inequality as a problem of unequal health outcomes drew on this international consensus about inequalities in health as resulting from inequalities in multiple social determinants of health, which accumulate across the life course. So if you have unequal access to healthcare or to healthy foods, or you live in a neighborhood that has poor air quality, or your housing is damp and leads to asthma and all kinds of other problems, these kinds of issues tend to accumulate across the life course and lead to poor health outcomes. Now, the full social determinants of health model includes both upstream and downstream determinants, social determinants of health. And the downstream ones are things that are, immediately related to health, access to nutrition, access to healthcare, things like this. But there are further upstream determinants of health as well, which in the literature on social determinants of health include inequalities in political power and socioeconomic inequalities. So interestingly, when domestic governments, excuse me, adopted this international consensus, they got the whole upstream downstream thing. They got the whole idea of acting on multiple social determinants of health to try to increase human capital and improve health outcomes. But they kind of left out the upstream economic inequality part. At the best, they focused on reducing poverty, which is great, and on other downstream factors, also a good idea, but they never really took on board the idea that inequality itself can cause health problems, and socioeconomic inequality can cause inequalities in health. And for those of you who live in the UK, you'll be sort of familiar with this line of reasoning from Michael Marmot and his psychosocial understanding of the link between inequality and health. Okay, so one of the results of reframing the problem of inequality in terms of health is, what's the policy solution? Well, the policy solution is health in all policies. And this infographic that you can see on the right here, I don't expect you to read any of that. The only reason I'm showing it to you is to show you how incredibly complex this policy solution is. It demands simultaneous action on multiple social determinants of health by lots of different actors in many different sectors, involving sort of back and forth between national level leadership and the people who have to implement the stuff at the local level. Huge amounts of coordination and cooperation, and it uniformly fails. So this is the main policy response to the reframed problem of inequality as health inequalities. It lacks buy-in from key ministries like finance. It's too bureaucratically complex to implement well. It usually ends up in lifestyle drift, which is the idea that you start out wanting to work on social determinants, but at the end of the day, all you can really do is beg people not to smoke. And you get this combination of multi-level governance in a context of fiscal constraint where subnational governments end up having to try to do more with less. So it really ends up being pretty much of a failure. Another way to think about what is happening with this reframing of the policy solution is that it shifts the Overton window around inequality. So the Overton window is the range of policy solutions that appear as reasonable responses to a policy problem at any given moment in time. And this beautiful picture is a little complicated to read, but I just want to sort of put it out there for you to take a quick glance at. The idea is that by the 1990s, the only policies that seem sort of reasonable or sensible or responsible for addressing inequality are things like activation and social investment and maybe cutting spending, cutting benefits, maybe, you know, a minimum wage here or there, health and all policies, this kind of stuff. But if you shift back to the 1950s and 1960s, there was a very different range of policies that seemed reasonable, things that now would be unthinkable, like confiscating property, nationalizing industries, etc. So the Overton window around inequality really shifts pretty dramatically, even from the 1970s and 1980s to the 1990s and 2000s. So after the shift in the Overton window, what's left in the window are these untested, extremely complex, very difficult to use policy levers that kind of go along with a more technocratic understanding of what the problem of inequality is. And what is out is the routine, tested, easy to use policy levers, things that a single ministry could do like tomorrow if they wanted to. And as a result, it turns what was a politically difficult but technically kind of easy problem into a politically easier but technically much more difficult problem. So the nature of the problem of inequality really changes. And I want to argue that the political difficulty of addressing inequality arises for politicians from a perceived necessity to avoid certain kinds of topics. These are topics that when I did the many, many interviews that I did for this book, people routinely referred to as taboo topics. I never thought I was going to write a book about taboos. That's not the kind of thing I do. But people kept talking to me about taboos. Taboo topics that they told me about are things that concern how the key mechanisms for containing inequality that were built into post-war welfare states, what is going to happen to those things? That's what becomes politically so difficult to talk about in this period. And it happens in this period because of the way that neoliberalism is challenging these key institutions for containing inequality. But it happens in very regime-specific ways because the institutions for containing inequality are different in different places. So this brings us back to the earlier stage of the process, which I promised I wanted to tell you a little bit more about, which ends in the development of political taboos. So where do these taboos come from? I argue that they emerge from the interaction of post-war welfare regimes with neoliberalism, and more specifically from the conflict between key institutions for containing inequality and the aspects of neoliberalism that are most threatening to those mechanisms. And both of these vary across worlds of welfare. So we can think about the golden age of welfare regimes not so much in light of the decommodification that they confer, but in light of the stratification that they allow. So if we go back to Esping Anderson, I think most of us tend to think most of the time about decommodification, but stratification turns out to be incredibly important too. Stratification is a central output of what welfare states do. It's not so much that social democratic welfare regimes, for example, are just bigger or better. They just want a different kind of stratification, different amount of stratification from what the liberal or social democratic welfare states want. So in all of these regimes, we see the primacy of politics that Berman talks about. None of these welfare regimes are built around the idea that inequality should just be left to, run rampant. So in each of the three worlds of welfare that Esping Anderson discusses, there are institutions that limit or correct market-generated inequalities. But these institutions are different depending on the regime. So the conservative corporatist regime, I think, is sort of easiest to see. You see these social insurance systems that are built to preserve occupational and gender stratification, for example. these social insurance systems are the fundamental mechanism for containing inequality at the desired level, which is to say, not make it go away, but just contain it where it's supposed to be. In a liberal welfare regime, the desire to preserve many market-generated inequalities, that is part and parcel of the liberal creed, leads to a smaller institutional apparatus for redistribution. So you don't see these big social insurance systems. You just insure against destitution and revolt. But for the main, you're relying on the alternation in office of labor versus capital favoring parties in order to provide an occasional course correction to the level of inequality, largely through changes to levels of taxation and redistribution. And finally, in the social democratic regime, the key institution for containing inequality is, again, taxation and redistribution, but in the main to provide high quality services. And in addition, regulation of internal markets for services and for goods is a technique that we see used more in the social democratic welfare regimes than in others, in part because they were doing, investments in human capital before it was fashionable. So to have a productive workforce, you need to invest in human capital. So welfare regimes eventually run into neoliberalism. The golden age is long gone everywhere, if indeed it was ever here. Recall that it was never so golden for some folks. And even Sweden isn't Sweden anymore. So what do these three worlds of welfare have to do with the politics of inequality today? Well, the main agent of change is the rise of neoliberalism, which results in changing ideas and beliefs and in a shifting balance of power among key actors in the political economy. Neoliberalism has the same common core, but it isn't experienced in the same way everywhere. The common core, and I take my definition here from Cornell Ben because I think his definition is really helpful and useful. The primary aim of neoliberalism is to safeguard economic growth in the context of open international trade and finance markets. So to do that, you need to ensure credibility with international financial markets, and you need to ensure that your firms are competitive in international markets. And you do this mainly by reducing government spending, by reducing the amount of regulation, and by reducing the taxes on higher earnings, especially capital income. So this is the gist of neoliberalism, but again, it doesn't happen the same way everywhere. We see these local variations depending on which part of neoliberalism is really kind of most important for a particular economy. Whoops. Sorry, there we go. So here's my big slide. This is what I think is going on, summarized in one 4x4 table. I am a Berkeley PhD, so I really should have a 2x2 table, but it's complicated. So we had to go up to 4x4. So again, very schematically, we can say that the distinctive taboos that prompt the reframing of inequality emerge from the interaction between the key institutions for controlling inequality in a particular welfare world and the key threatening aspect of neoliberalism. Now, I should tell you that this schema is presented as if I arrived at it deductively, but of course this couldn't be further from the truth. I first noticed the taboos because my interviewees were telling me about them. And then I worked backwards to try to understand where these taboos came from. So in the liberal world, as we've seen, the key mechanism for controlling inequality is alternation in government of left and right parties. Markets are allowed to generate significant inequality, knowing that this course correction will come about when a labor-backed party is voted into government. The key neoliberal challenge is thus the ideational hegemony of neoliberalism itself, which leads to the major parties of the center-left and center-right adopting very similar economic policies. And under these circumstances, the center-left finds it very difficult to even say the word redistribution because it brings up dangers on all sides. It reminds committed leftist egalitarians of everything that the center left is no longer willing to do. And it threatens to alienate more centrist voters and economic interests on the right who fear redistribution. So it becomes a taboo topic. And if you go back to, sort of the minutes of Labor Party meetings at around this time, I mean, they really talk about, you may not say the word redistribution. Now, in the conservative corporatist world, the key mechanism for sustaining inequality at the desirable sort of medium level is the social insurance system and cash transfers as needed to compensate the losers of economic recalibration. This is the classic passive status reinforcing welfare state. The key problem presented by neoliberalism for these welfare states is that neither international financial market actors nor the EU are willing to permit public spending on social benefits past a certain point. And so we see that the reframing of inequality in this world really comes about in an effort to avoid talking about social spending, which would alienate supporters on the right, and again, remind those on the left of the costs of the fiscal orthodoxy that is demanded of EU membership. Finally, in the social democratic world, the key mechanisms for controlling inequality outside of the labor market, which is sort of a separate story, the wage inequality piece, but the key mechanisms for controlling kind of, post-market inequality are high taxes and the regulation of internal markets for goods and services, which allowed for substantial social investment. The social democratic world also face the challenges of ideational hegemony. The idea of economic necessity in Finland, for example, was adopted by the left to argue that there was nothing that could be done. One has to do everything possible to keep international financial markets happy. And this made the issue of the tax treatment of capital income, which changed dramatically in Finland and resulted in massively increasing inequality, it made that topic taboo. I think unique to the social democratic world was the challenge that was posed by EU market rules, which made it much more difficult for governments here to regulate their national markets as they once had. And this results in a taboo, although I think it's a somewhat weaker taboo, against discussing re-regulation of markets. So that's the story about where these taboos come from. The failure to reduce either economic or health inequalities in the early 21st centuries can be traced back to early welfare state configurations and how they interacted with rising neoliberalism in the 1980s and 1990s. But what does this tell us that can help us understand the politics of inequality after the pandemic? I think that it helps us to think about regimes and what regimes are and why inequality is sort of regime-y. Regimes are characterized by interdependent parts, interlocking parts that are complementary and dependent on one another. And these different parts can be about ideas, about power configurations, institutions, logics of appropriateness, norms, practices, etc. But it can also be about multiple forms of inequality that are interconnected and complementary. For example, the underlying social inequalities that result in health inequalities. Regimes are also characterized by a self-reproducing aspect, that these institutions that make up regimes, the institutions and outcomes and all of that stuff, tend to reinforce each other. And in the case of health inequalities, I think we see that institutions that were designed to contain inequality in the post-war period end up as the flashpoints around which these new, less equal regimes of inequality develop later on. And all of this brings to mind a public health concept with which some of you may be familiar, which is the concept of a syndemic. A syndemic is a set of at least two widespread health problems that are linked to each other in a way that they interact synergistically and they tend to reproduce and exacerbate each other. And the classic example of this is HIV, AIDS, and drug use, intravenous drug use. So the use of the needles, ends up reproducing HIV/AIDS, but the social consequences of living with HIV/AIDS under certain circumstances can exacerbate the intravenous drug use, et cetera. So this is sort of the original idea of a syndemic, which in this new book with Claire Bamber and Kat Smith, we talk about in terms of COVID-19 and the underlying inequalities, the underlying social inequalities that lead to really intractable inequalities in COVID. So at the beginning of the pandemic, there was this narrative that, you know, we're all in it together. Death doesn't discriminate. Now I think we know. Pre-pandemic inequalities are really, really strongly related to inequalities in COVID-19. There's no doubt about that. So now the narrative has changed a little bit. Now we're talking about inequalities as being linked to sort of botched responses, particularly in places where the government response has frankly been terrible, like the US or the UK. Also in places where the government response has been controversial or contested, like in Sweden. So the argument that we make in this book is that responses to these kinds of inequalities on the parts of governments, so responses to COVID inequalities, are largely on path in the sense that there's not a lot super unexpected going on here. This isn't about sort of politicians making unexpected mistakes. That a lot of what we see is really very easily explainable. And that syndemic inequalities are a result of much longer term decisions and policy patterns. So when we think about what governments can do during a pandemic, we usually think first about sort of containment, testing and tracing, travel restrictions, school closures, lockdowns, et cetera, and now also vaccine distribution. But there are lots of other things that governments do that impact outcomes during the pandemic, including interventions in the health system, policies that affect essential workers, social policy interventions that affect everybody, unemployed workers, families, et cetera, and then also economic and labor market policy interventions. So most of the comprehensive systematic research that has come out so far on government responses during the pandemic has been on containment policies because they're relatively easy to measure. I have been starting to collect data on these latter four categories, which has turned out to be quite a job. So I've been building a new data set of these other kinds of policies, health, social, and economic policies, based on sources listed in the Oxford Super Tracker, as well as some others coming from labor organizations and governments. And I have a first set of cases that I've been looking across US, Canada, UK, Sweden, Denmark, Germany, and France, including subnational units. And we're just trying to figure out what the heck our government's doing. In particular, we've been attentive to whether policies that they have put into place to deal with the pandemic are new policies or whether they really are changes to or extensions of existing programs. And I want to say right here, a million thanks to my undergraduate research assistants at Penn, Brendan Louie, Gabriella Rubito, and Anna Schwartz, who have been amazing in helping to gather this information on really short notice. So I'm going to characterize some early results of this study. I'm not going to attach any numbers because we're still working on establishing the coding system. But I want to tell you just really briefly what we've found. So, excuse me. Overall, all governments across the rich industrialized democracies, at least those in this initial set of countries we've been looking at, seem to be doing more or less the same kinds of things. They're helping people with living expenses, they're supporting private sector firms, they are supporting essential workers in various ways, and they're intervening in the health sector. There are lots of different things that governments can do, but these are the main categories, and they all do a little bit of all of those things. So they're choosing from the same menu. But the specific choices, the specific dishes, the portion sizes, and the clientels at the restaurant vary quite a bit. Now, some of this variation is clearly unsystematic. People are just making decisions based on the best information that they have, and doing what they think is right. I think Sweden is actually a really good example here, and their attitude towards lockdowns in particular. Some of the variation in what governments are doing seems to be related to state structure, in particular the degree of decentralization in certain policy areas and the degree of autonomy that subnational units have. Government partisanship seems to have some influence in some cases, but it's really not determinative in most cases, and it's not clear to me at the end of the day how much that's going to matter. Most of the variation that we see across governments in terms of their pandemic response is really very congruent with the kinds of policy patterns that we've seen in the past. In the liberal welfare states that we've looked at, we are seeing things like temporary and low levels of assistance, not a lot of support for essential workers or other workers. Labor market and economic interventions tend to employ credit and tax reliefs rather than direct subsidies. These are all things that you would sort of expect in a liberal welfare regime based on, historical policy patterns. The same is true of the conservative, corporatist, and social democratic government responses. In general, they tend to look a lot like the policies that we would expect based on a 3 worlds or, in some cases 4 worlds or 5 worlds kind of delineation of welfare regimes. Why is this? Why does this response seem to be so strongly path dependent? Well, one reason is that the vast majority of the interventions that we've seen are actually extensions of pre-existing programs, not new programs. And that's because it's just much easier when you're in a crisis situation to amend or expand something that already exists rather than to start from scratch. Now, there have been some exceptions to this, and actually the CARES Act in the US, as limited as it was, there were some real path departures, like the introduction of the first paid sick leave ever in the United States. But most of the policy responses that we're seeing are really building on pre-existing programs. There's also a tendency to stick with the same kinds of policy tools and policy levers that you've used in the past. There's a level of comfort in using subsidies, if that's what you're used to doing, versus using tax relief. We definitely see the sort of continental versus social democratic breakdown of, cash transfers versus services that is alive and well. And then, of course, it's also the case that underlying attitudes and ideologies about inequality are probably driving some of these response patterns, and they also drive the earlier policy patterns. So there's sort of an omitted variable issue there. So I'm wrapping up now. I'm sorry I've gone a bit long, but here we see a virus instead of a cake, because explaining the new normal of high COVID-19 inequality really turns out to be kind of, a little disappointing in a sense. There's not a lot new here. There's not a big new story to tell. And that is because COVID-19 inequalities are not special. There are very strong associations with the underlying socioeconomic inequalities. COVID-19 inequalities are worsened by existing health inequalities. Deaths have occurred where governments have failed to target resources to the most vulnerable, for example, nursing homes, poor neighborhoods, precarious workers like meat packers, before the pandemic. It's nothing new. And indeed, at an ideological level where neoliberal ideas have been most dominant, the pandemic has been experienced most unequally. Well, why? Because economic and health inequalities are syndemic. They co-occur and they contribute to each other through multiple pathways, which means that they reinforce each other. So I want to close by thinking about some lessons. If we think about the study of comparative social policy which has really been, I think, very dominated and often very helpfully dominated in at least some parts of the literature by ideas about path dependence and critical junctures. I think we need to confront the idea that the global pandemic is not necessarily a critical juncture. And this is because for the last 45 minutes, I've been talking to you about how the politics of inequality really develops in the long shadow of post-war institutions. So it's hard to get away from these self-reinforcing, interlocking regimes of inequality. And so far, we've seen very little path departure. Now, that's not to say that we won't see it. I could be wrong. I hope I'm wrong. But so far, I think what we're seeing is that the tight coupling of different dimensions of inequality, socioeconomic inequality and health inequality, within a regime really contribute to that persistence, and it is strong. Secondly, I think we need to acknowledge that the framing of inequality, the way we talk about what inequality is as a problem, continues to have an impact on policy choices and on the effectiveness of those choices. And we as researchers need to be really careful about that. So if we further medicalize the problem of inequality in the way that already happened starting in the 1990s and 2000s, which is going to be very tempting to do in a pandemic, this is likely to affect the policy response in ways that I think are going to make the syndemic of inequality and COVID-19 harder to resolve. We're going to be really focused on healthcare and on disaster preparedness and health security, for example, and we're not going to be spending enough time thinking about the income distribution and how to shape that in ways that are likely to contribute to better health. Let me think for a minute about lessons for actual policy as well as for the study of social policy. So I think that to break the COVID inequality syndemic, we need policies that are going to act both on health and on the underlying social inequalities. So during the pandemic, we need things like paid sick leave and access to healthcare and protections for essential workers and affordable PPE that keep people from getting sick. And we also need policies that can reduce the unequal socioeconomic impact of the pandemic. So the kinds of things that governments have done pretty well in a lot of places could maybe need to do a little bit more of in terms of supporting people during lockdowns and during school closings. But we also need policies that can address the underlying socioeconomic inequalities that really drive health inequalities. We really must address the hollowing out of the middle of the income distribution. And we need to think about seriously equalizing educational quality and access. And finally, we need policies that can break the link between low socioeconomic status and poor health. High quality healthcare, including mental health care for everybody, improved nutrition programs, workplace safety, things like this are kind of unfashionable, but actually they can make a big difference, even even while we're still working on getting the income distribution fixed. And finally, a word on politics. Sorry. What's going on here? Why haven't we done this already? We know what needs to be done. Key problem is that these syndemic inequalities of health and income inequality, they skew our politics. They skew who's alive to vote. They skew who's available to participate and how they participate. And they skew who politicians listen to. The fact that our societies are so unequal contributes to a lack of a sense of solidarity between the ruling class and between those who they rule. And in order to change that, I think we really need political reforms as well as policy reforms. And in the book, we close with a call for a set of reforms to politics that can try to increase the voices of ordinary people. So I'm going to close there. Again, apologies for going on a bit long, but I'm done.